Acessa is a very unique way to treat all the uterine fibroids a woman has while leaving the normal uterine tissue alone and safe.
The Acessa procedure is done under general anesthesia, so the patient is given medication to help them go to sleep.
The Acessa procedure usually takes anywhere from an hour and a half to 4 hours, depending on the number and the size of the fibroids. If you only have 1 or 2 fibroids and they're not overly large, the Acessa procedure doesn't take very long.
The incisions that you'll have with Acessa are very small. One incision is usually at the level of the belly button and is less than 1 inch. The second incision that you'll have with Acessa is at the mid-abdomen and is approximately 1.5 inches long.
There's a little tiny hole, less than the size of a pencil, that where the Acessa probe goes through, and as the Acessa probe comes out of that, it leaves a little tiny hole there, but that hole is very minimal in size and it leaves very little damage, and that part of the uterine wall grows back together again.
We use laparoscopy, which is using a camera to actually look directly at the uterus and the fibroids. And we do ultrasound to survey the anatomy and make sure that we have the fibroids that we're looking for and we know where they are. Once we ensure that the device is deployed into the fibroid and treating the fibroid and sparing normal tissue, we deliver energy to the fibroid.
The Acessa uses a certain type of energy that then goes into the fibroid, that heats the fibroid up and kills the cells of the fibroid. Over an eventual period of time, those cells break down and then the body reabsorbs those cells over a period of time, which can be anywhere from a 3 to 12 month period of time. Now the fibroid may not totally go away, but it shrinks and many of the symptoms diminish incredibly.
The day of the procedure, I arrived at the hospital and I had done all the pre-op in advance, so I checked in and I was literally whisked up to my room, and then it was just a matter of waiting for the procedure to start.
For some reason, I was not nervous. My doctor was wonderful and her team, and it was a 2-hour procedure with 2 hours in recovery, and I was able to go home the same day.
Within an hour probably of recuperating from the anesthesia, I put some clothes on and was wheeled out to the car and sent home.